POMGEN staff fall ill as COVID cases surge. Former Prime Minister calls for transparency. And COVID-19 vaccination will be voluntary.
This is National MTV News with Helen Seah.
Good evening and thanks for joining us for Wednesday's news. Former Prime Minister Peter O'Neill says the country is headed for a major health crisis and is calling on the government to clarify where the borrowed funds for COVID-19 have gone. This comes a year and a day since the country announced a national emergency for the pandemic. In the meantime, Prime Minister James Marape has praised the national response so far, saying there's still more to be done.
The former Prime Minister's concern comes at a time where there is growing concern in health as cases of COVID-19 continue to rise.
Premier research institute in the country is Institute of Medical Research based in Goroka. From the reports that we are getting, the chairman of that institution, Professor Siba, is unhappy with the way this crisis and COVID-19 is managed in the country.
Mr. O'Neill questions the government's spending on COVID-19 efforts.
We know that they've been borrowing billions and billions of kina from IMF, from World Bank, from the Australian government, from ADB, from Japanese government. All this money, where is it gone?
It's been a year and a day since the government declared a national health emergency. Prime Minister James Marape acknowledges the work that's been done so far.
We started our journey to fight COVID-19 in a systematic manner, especially the way we started with one index case 1 year, this time last year. We went on a very aggressive lockdown, shutting on our borders, and to ensure that we try to be defensive in as far as fighting COVID-19 is concerned.
While the first supply of COVID-19 vaccines have arrived in country, there are still growing concerns from businesses in light of the second surge. O'Neill says government has to manage that aspect as well.
Many Papua New Guineans at the front line of all these businesses are the first ones to suffer. Most of the SMEs, their businesses and their loans are being repossessed, meaning that Papua New Guineans businesses are shutting down because they don't have the capital and they don't have the facilities to continue operating.
Bradley Valenaki, National MTV News.
Prime Minister James Marape says COVID-19 vaccination will be voluntary, but if people in the country do not want to be vaccinated and eventually turn out contracting the virus, law and order agencies will be out in full force to ensure proper isolation procedures are followed. PM Marape was speaking yesterday at Jackson's International Airport upon receiving 8,000 doses of AstraZeneca vaccines from Australia, along with an AUSMAT team.
For our own medical and scientific community and our health department, we're not here trying to pass on a second-class vaccine to our citizens or something that is not proven. It has taken us a long time to make this call. We've been on the lookout. Some of you may accuse us, why did we take this time to make this call? We held back. Our own medical and scientific community have said, they've looked at what's happening in the US, for instance, the Pfizer vaccine, and they looked at what's happening elsewhere, in China and elsewhere. We looked at what was happening in Australia. We held back until we're absolutely certain that for PNG, this is the vaccine that is best, can be taken in and available for us to use. And as I said, for those of you who don't want to take vaccine, and if you feel you're a superhuman being, we will have the isolation strategy that police will deploy and use. And if you found to be COVID positive, your freedom for 2 or 3 weeks can be lost. We will pick you up, we lock you away. That's the sort of way we're trying to move in to ensure that we stop COVID-19 from spreading. COVID-19 spreads when people are moving around and talking. Simple as that. You see, China, they were able to control and suppress it down to almost nil in 3 or 4 months' time. Well, at the time they were doing it, there was no vaccines available. They were purely doing it on people control, people movement control. And so for those of you who, we will try our very best to make vaccine available as we go through the balance of this year. and it's up to you. If you prefer not to be vaccinated, well, if you get COVID-19, and it's proven from a competent lab that we've established right across, and it's COVID-19, then we are working with districts and provinces and the city municipal to ensure there are recognized isolation facilities set up, including guest houses, including houses, including classrooms. We're trying to set up all these isolation facilities nationwide, so we pick those who are identified to be COVID cases.
Public motor vehicle owners and operators have been warned to adhere to the COVID-19 national containment measures under public transportation. Road Traffic Authority CEO Nelson Tarama reiterated the message by the controller of the PNG COVID-19 National Pandemic Response, David Manning, saying measures will come into effect starting tomorrow, Thursday, 25th of March.
CEO Terema in a briefing today said the first 2 weeks will be used by all partner agencies to assess and make sure that PMVs are adhering to the containment measures under public transport, which are: face masks must be worn on all public transports at all times except for children under the age of 12. Taxis are allowed to carry a maximum of 2 passengers. PMVs with under 25 seats are allowed to carry only 5 passengers. PMVs with 25 to 30 seats are only allowed to carry 15 passengers. Failure to adhere to these measures is an offense under the National Pandemic Act 2020.
So the stakeholders are NCDC, defense personnel, police personnel, Road Traffic Authority Enforcement Unit, and NCDC Enforcement Unit. We will all be working together to carry out and implement those orders in the public transport in Port Moresby. So we had a meeting, we agreed, and we will be stationing at different bus terminals in the city, and we have already put up tents where we will be stationing. So those bus terminals, especially Unagi Field and the Gordons area where buses come to exit. So those are the areas that we will be looking at and concentrating. So the police and defense will be supporting RTA and NCDC to provide the support in terms of enforcement. So we will be stationed as of tomorrow, and for the next 4 weeks or a month, we will be stationed on those various bus terminals to making sure that all traveling public must wear face mask in all both modes of public transport, both PMBs and taxis.
Mr. Terema reiterated Controller Manning's warning that if operators do not comply to these measures, then they are at a risk of losing their license to operate as PMVs.
If we see that PMV drivers and crews are not complying with these directions, well, we have no choice. That's the message that we are going to give it to them. So, like first 2 weeks, we'll assess the situation whether the crews and drivers are following the instructions. This is a partnership. We have to work together. The crews and the owners of the operators or the public transport, they need to take ownership of this. The government allows them to conduct business in providing public transport in Port Moresby and elsewhere. We all have to be more responsible. If you see that your crew and driver must make sure that they to have these items like face masks and hand sanitizers in their vehicles.
The general public are also encouraged to take ownership and adhere to these measures, as it is a collaborative effort by all parties.
So even the traveling public too, they must comply with this. Their safety and the safety of the other people in a public transport is very, very important. The crew and the driver, of course, they are human beings as well. So they are trying to help and save lives. So people need to respect and take ownership of such instructions. So we all have to work together to achieve and minimize the current high rate of positive cases in the city.
Florence John Duo, National EMTV News.
Central Province Governor Robert Agarobe is urging his province to practice the new normal, adhering to the COVID-19 protocols. A team in Central Province will be in place to carry out awareness on COVID-19 measures.
Governor Robert Agarobe says the COVID-19 measures set by the controller David Manning is in place and the people of Central must follow. Governor Agarobe continues that awareness will be carried out in the province.
The Central Provincial Government and its provincial and district administrations through their respective health divisions and together with the Provincial Health Authority must continue to emphasize through awareness activities that all COVID-19 test practices are adopted by all citizens.
Schools in the province are closed, a liquor ban is in place, roads will be monitored and public gatherings reduced, and the wearing of masks is mandatory.
At the villages, trying to keep up with the essential masks and gloves and hand sanitizers will always be difficult. A lot of our people will not be able to have access to that. So, I'd like to encourage our people in our communities to practice what we always do. When you're sick, you steam yourself.
The central government has established the Aniani Corporation to purchase produce from local farmers, limiting travel in and out of the province.
Farmers get involved with the ward councillors, organize your harvesting times, and Aniani will come in and buy your food at the local areas. We've been doing that now for the last 8 months. And we will then source the market here. So that stops our people from traveling unnecessarily into town.
The Department of Health announced a total of 26 confirmed cases in the province as of midday today. Gertrude Gabi, National EMTV News.
The total number of COVID cases in Morobe Province stands at 167 as of Monday, with 6 confirmed COVID-19 deaths so far. Of the 167 cases, 110 are active cases and 51 have recovered. From the active cases, 5 are currently admitted at the COVID-19 center. The other 105 cases are mild, therefore are being isolated and treated at their homes.
Morobe Governor Ginsen Saunu in a media brief said Morobe's confirmed number of COVID-19 cases now stands at 167. From this number, 110 are active cases and 51 have recovered. From the active cases, 5 are currently admitted at the provincial COVID-19 center and the other 105 cases are in isolation and treated at their homes with medical clearance. The COVID-19 death toll in the province stands at 6, with most dying from pre-existing medical conditions compounded with being infected with COVID-19.
The COVID-19 has claimed the lives of 6 of our citizens. And it's not a joke.
The breakdown of the 167 cases in Morobe by district shows that Leh has 154 COVID-19 cases, Nawai with 8 cases, Makam and Bulolo districts with 2 cases, and the Huengulf district with 1 case, and others, which include Minyama, Finchofen, Tewai CSC and Kabung, have no cases. The Morobe COVID-19 committee have stated that these figures does not mean that the districts with no cases are immune to COVID-19, but rather most likely less tests are being done in those places due to a limited supply of GeneXpert. The Morobe Provincial Authority CEO Dr. Kepos Binga said the province urgently needs more supplies.
Our numbers has come down to 200 now. We've got about 200 or so as we speak now, and it's going down fast. So that's why part of our appeal also is to the NDOH and others, to the department and the Central Lab Laboratory. If they've got others, some staff in Salono, they need to supply us, not only us, but the other provinces as well, because there's a surge.
Dr. Binga also wants the PCR testing site at Engau to be up and running so tests can be done in the province to reduce the PCR turnaround time of 8 to 10 days.
We also have a PCR machine that is sitting there for this more than 5 months, I think. We need to get that working. There's technical things that we need the support of the Department of Health and the Central Laboratory to come and assist us.
Morobe Governor has joined the health workers in the appeal to the public to maintain the practices of wearing masks, washing hands, and to stay away from gatherings and crowded places. COVID-19 tests in the province are being done in Ley and in other districts as well. In Ley, the tests have been done at Buimo, Malahang, 10 City, Butibam, and Milford Haven clinics, as well as the main stadium. The testing facilities outside of Ley are located at Wampar, Buana, Mutsin, and Bulolo. The province has released 8 new COVID-19 measures, which came into effect as of yesterday. Charlene Airy, National EMTV News, Ley.
A 3-day workshop for healthcare workers from various healthcare facilities in Madang province is currently underway to train workers to do surveillance for COVID-19. The training, funded by World Vision and UNICEF, includes swabbing in order to increase the sites for swabbing and active testing in the province so health workers can do their jobs accurately to combat the coronavirus.
Healthcare workers from various healthcare facilities in Madang, including rural health facilities, church-run health clinics and private health clinics, are part of this training.
After this training, they would assist us to do surveillance for COVID in their respective facilities. They would do swabbing, so we want to increase the sites for swabbing and active testing in the province.
The training aimed to train the health workers to do swabbing for COVID-19 testing, whilst training them on how to look after themselves and the patients in the hospital. For now, the Madang Provincial Hospital is the only active site to do COVID-19 testing.
How to take care of themselves and the patients in the hospital to minimize the risk of cross-infections among patients, staff, guardians and visitors to the hospital or the healthcare facilities.
The officers are also trained on clinical referral pathways and risk communication. According to Sister Ipit, risk communication is currently more of a challenge for the health workers.
Which is currently more challenging and it's stigmatized. And now with the debate on vaccines and all these things coming up, we want them to be good and effective communicators in that area.
Following the training, the health workers will also get their PPE supplies and information kits to their respective health facilities. The 3 days workshop ends tomorrow. Martha Louise, National EMTV News, Madang.
You're watching National EMTV News. We'll be back with more stories after the break. Stay with us. Welcome back. A new legal help desk to assist survivors of gender-based violence in NCD has been established by the National Capital District Commission in collaboration with Port Moresby Chamber of Commerce and Industry and UN Women. Launched today to mark National Women's Day, the initiative aims to build legal capacity and improve the quality of legal services available to GBV survivors.
The NCDC Gender-Based Violence Secretariat revealed during this morning's media conference at City Hall that about 70,000 women in the nation's capital are affected by gender-based violence. And only 6% of these make it through the legal system where their cases are successfully dealt with or receive legal support. This has prompted NCDC to collaborate with the Port Moresby Chamber of Commerce and Industry as well as UN Women to come up with the initiative of the Legal Help Desk in addressing the issue of gender-based violence in the city.
We have a lot of cases being reported, but it comes back to, women need to have confidence. They need to feel that they have something to look forward to. They have to feel that support at the back of them, and that's that's not present at the moment. So a lot of women fall back in the referral system. They drop their cases, sometimes due to the prolonged court battles. They can't take it, every day they have to go to court. And most of these women cannot afford to do that every day.
Principal among the causes of gender inequality, disparity, disempowerment is gender-based violence. As we speak and as we face COVID-19, gender-based violence is not going for an holiday. It's not retreating. In fact, it's escalating.
Governor Pakop said the NCD-GBV referral pathway has legal support services missing, with women either representing themselves or deciding to drop cases as court battles prolong. He says this tangible step, championed by the coalition of parliamentarians, comes as a huge relief to survivors who often struggle with lack of information and affordable access to legal services. Having a legal background himself, Governor Pakop says the collaboration arrangement with POMCCI will have the legal arm of the NCDC-GBV Secretariat established in a month's time, with POMCCI President Rio Fiocco, a renowned lawyer in the country, heading it.
POMCCI has agreed to fund the cost of engaging a lawyer who will serve the needs of our members where their employees need to seek assistance to protect their legal rights, as well as the general public. The help desk will enable GBV victims to go to a one-stop shop where they can meet with counsellors as well as a lawyer. POM Chamber will also be reaching out to our law firm members to provide the services of their lawyers on a pro bono basis to assist the GBV Advocacy Centre.
Governor Pakop also stressed that the same arrangement will be replicated in other provinces represented by 20 members of the Parliamentary Coalition Against Gender-Based Violence. Dennis Orere, National EMTV News.
There is a shortage of health workers at the Port Moresby General Hospital Emergency Department following a number of staff falling ill to COVID-19. Chief Emergency Physician Dr. Sam Yokopua says soon they will be calling for volunteers as the number of workers now in isolation increases.
Our cameras were allowed into the country's biggest referral hospital, Port Moresby General Hospital. This is the emergency department. We see firsthand the response to general health matters as well as COVID-19 during the health crisis. While dealing with the day-to-day needs of the sick that turn up each day, the staff remain vulnerable also to COVID-19. As first responders to health needs, the number of health workers attending to the sick continues to drop as staff fall ill to the disease.
COVID is real. COVID is real, and you see we exhausted, staff are exhausted, looking after more than 10 patients in here. So in here, one nurse is looking after 6 patients. It's too much. Yeah, but this is real. We are working. We have to help. As a nurse, we promise to save the patient. We are here to save the patient. So we have 6 staff who have been tested positive. And they are quarantined. They are away from the roster, leading to most with less staff on duty.
The man in charge of the ward, Dr. Yokopua, says COVID-19 supplies such as oxygen tanks are of greater need as a patient can use about a cylinder of oxygen within 2 to 3 hours. Added to the already burdened health situation is shortage of beds in the emergency ward. We are told it's the same story at other COVID facilities around the capital city.
Yeah, we've got 10 beds, all the 10 beds are full. We have moved some of the patients to the isolation ward on the other side. It's full, the 16 beds are full. We've moved some to Ritaflin. The Ritaflin is about 80% full at the moment.
Dr. Yokopua insists on having patients with severe symptoms of COVID-19 in the hospital facilities because they have a higher chance of recovery than isolation at home. They say it's likely that if this situation continues, they will be calling for voluntary help.
That's one of the dangers of home isolation, so that we are very, very scared of. That's why we called in the AUSMET, the Australian government, and we're building field hospitals so that these sort of people, instead of doing home isolation, And when they're complaining of short wind, we quickly get them in and we keep them, and so we observe them. Otherwise, they'll be dying in their beds, sleeping at home.
About 90% of the staff at the emergency department have agreed to get the COVID-19 vaccine as the government plans to vaccinate frontline workers as priority.
Our National Department of Health, it is advisable that we get our vaccine. So yes, there is true, there's a division. However, we'll advise for vaccination.
Gertrude Gabi, National EMTV News.
Acting Chief Justice Amben Kandakasi is challenging aspiring female judges, lawyers and magistrates to aim to be a judge of the National and Supreme Courts. He said this yesterday in Mount Hagen at the ceremonial sitting of the former Mount Hagen resident judge, late Justice Regina Sagu. Late Justice Sagu passed away on the date of her one-year anniversary after being appointed to the bench.
Late Justice Sagu's casket was flown from Port Moresby to Mount Hagen yesterday by the judiciary headed by the acting Chief Justice, Justice Amben Kandakasi and Justice David Kennings. A ceremonial sitting was held at the Mount Hagen National Courthouse to farewell late Justice Sagu before her body was brought to her resting place in Enga Province. Acting CJ Justice Kandakasi described late Justice Sagu as a woman of integrity and that no mountain was too high for her to climb.
So the judiciary, the country, our people need a woman, not necessarily a woman. I described it as a man-child produced into an outcame of female-bodied human being.
She spent her 27 years involved in judicial education, was a lawyer, a magistrate, and had been heavily involved in the reopening of district courts in Wabek and Mount Hagen. The acting Chief Justice is challenging female lawyers and magistrates to take care of their integrity and follow the footsteps of late Justice Sagu. Justice Kandakasi said integrity is the key to becoming a successful female judge and would help better serve the nation, just like their fallen colleague.
See, I understand reliably. They also initiated discussions in the Western Islands province to see district court services return. And as long as those services are worked out, those of us remaining in the system to pick up, our people need judicial services.
Justice Kandakasi said the opening up of district courts is an important judicial service the people need from them. He said national and Supreme Courts are not for everyone except for serious civil matters and criminal cases. Vasanata Yama, National EMTV News, Mount Hagen.
The Papua New Guinea Chamber of Commerce and Industry has condemned the attack on a business in Kokopo, East New Britain on Monday. The attack resulted in the death of an employee by a group of armed men wielding machetes and guns. According to PNG CCI President, the entirety of the attack is one that was uncalled for, unnecessary and should not be repeated anywhere else in the country. He added businesses play a crucial role in providing services and support to local communities they operate in and that we should work to protect them. The PNG-CCI is calling on relevant authorities in East New Britain to ensure that the perpetrators are identified, arrested and face the full force of the law. PNG Ports Corporation Limited has posted a profit of 83 million kina for the 2020 fiscal year. This has enabled them to pay a dividend of more than 21 million kina to the state for the year 2019. This announcement was made yesterday during the check presentation of more than 11 million kina as dividend to the government. This payment is from the company's 2019 audit net profit after tax, and it is the remainder of over 9 million kina paid in November last year.
In a small ceremony yesterday, over 11 million kina was presented to the SOE Minister William Duma. This payment is from the company's 2019 audited net profit after tax, and it is the remainder of over 9 million kina paid in November last year. This brings the total dividend paid for the year 2019 to over 21 million kina.
Because last November we paid 9.6 million kina, so the total dividend for 2019 that PNG Ports is paying to the state is 21,044,978 kina and 50 toya. So that's the total dividend for 2019.
Despite the gloomy economic situation the country is faced with due to the COVID-19 pandemic, PNG Ports has recorded a profit of over 83 million kina. This has enabled them to pay the dividend to shareholders. Last year, they were also able to pay off taxes of more than 43 million kina. These taxes are for the year 2019 and advance tax payments for the year 2020.
Also, PNG Port has paid taxes of more than 43 million kina. To IRC. That was for 2019 and then also an advance tax payment for 2020.
Being an organization mostly reliant on trade, PNG Ports was severely affected after the closure of borders and other restrictions last year. The adverse impacts of the pandemic on business were costly. However, cargo volumes are picking up slowly and revenue is fluctuating but is being managed. The profit and dividend payment is the result of stringent cost-cutting measures and strategic decisions that the management had to make.
Despite COVID, we were able to maintain the port operationally. When we had COVID last year, management went in very quickly and instituted certain protocols at the ports just to maintain, to keep the ports operating. So there was no any stage that any of the ports were closed down.
SOE Minister William Duma was there to receive the dividend payment on behalf of the state. He thanked PNG Ports for the payment, saying PNG Ports is one of the best performing SOE in the country.
First, let me congratulate and thank the chairman and the managing director of PNG Ports for the work that yourselves, together with the board and employees of Ports Corporation, have been able to at least return a dividend for us. Ports Corporation have consistently been one of our best performing SOEs over the last couple of years.
Rayon Lakingu National, MTV News.
And now looking at the NAS Fund market report, the kina opened unchanged at $0.2850 in the interbank market this morning. At Bank South Pacific, your kina will buy $0.2775 $0.3589 Australian dollars, $0.3923 New Zealand dollars, and 29.51 Japanese yen. Looking at commodity prices, at New York closed, gold is trading lower, coffee and cocoa closed lower, and copper closed higher. Palm oil closed lower, crude oil is trading lower, and copper closed higher. And on the stock market, the Dow Jones closed lower, the ASX 200 is trading higher, and the All Ordinaries is trading higher. National EMTV News continues with more stories after these messages. Don't go away. Welcome back. Wewak MP Kevin Isifu has joined the leaders of East and West Sepik Province to condemn the killing of a 30-year-old man in his electorate. Ernest Natalie from Aitape, West Sepik Province, died instantly after a gunman shot him at close range while he was traveling to Aitape from Wewak. The PMV he was traveling on succumbed to an armed hold-up at Banak in Dagoa LLG along the Simagun Highway, and it appears that the victim was specifically targeted. According to the local MP, this was not the first time such attacks targeting the people of West Sepik have occurred along the highway. Isifu has commissioned a manhunt with the help of a police mobile squad 06 since Monday. West Sepik Governor Tony Wowo has described the killing as barbaric and diabolic act against the people of West Sepik. Both Isifu and Wowo extended their deepest condolences to the family of late Ernest. Motu Koita Assembly, in partnership with Water Aid, launched 3 videos today to help spread awareness on COVID-19 safety measures, social distancing, wearing of masks, and washing or sanitizing hands regularly are basic preventative methods that the Motu Koita Assembly and Water Aid PNG are intending to reach out to the public in visual form. The project is targeted towards the Motu Koita communities. The videos are voiced in Motu with English subtitles.
The Motu Koita Assembly and Water Aid Partnership started this project in May 2020 and are working together to promote safety measures. The videos will be uploaded on The Motu Koita Assembly and Water Aid Partnership started this project in May 2020 and are working together to promote safety measures. The videos will be uploaded on social media platforms for people to watch and have a fair idea on ways to protect themselves from COVID-19.
And we trust today the release of these 3 videos will assist people to understand better, encourage them more to follow the very basic, very simple principles on how to reduce the action of this COVID-19 in our community.
One of the videos launched today shows how to make a tippy tap using simple materials, and another shows methods of sewing face masks. Water Aid Director of Programs Navara Kienes says this project is aimed to bring about more knowledge to the people.
The videos were basically targeted towards Motu Koita communities who are our target population for this project, and we wanted to we're releasing them now to kind of emphasize the importance of following these prevention practices.
The videos are believed to bring about change and for people to adapt with the new normal during this event of outburst. These are basic preventative methods that must be practiced by all to reduce the spread of COVID-19 in the communities.
The basic levels right. We must get social distancing, hand washing, masks on, people doing the basics. If we can get through that, the amount of assistance, the amount of reduction that will help with the spread of this COVID-19 will be amazing.
Water Aid PNG and Motu Koita Assembly will share these videos on their respective media platforms and distribute to the communities in Motu Koita. Gertrude Gabi, National EMTV News.
Trukai Sports is next. Details after the break.
Trukai Sports.
Welcome to Trukai Sports. The heavy downpour yesterday has exposed a bit more than maintenance for the PNG Sports Foundation office at the Sir John Guy Stadium. Acting CEO Michael James and the staff have discovered a leaky roof caused half the ceiling in their office to collapse.
The Papua New Guinea Sports Foundation has suffered damage after last night's heavy rain in the nation's capital. This morning, Acting Chief Executive Officer Micah James was distressed as he walked into an office in ruins. PNG Sports Foundation is the government's agency for sports and is located at the Sir John Guy Stadium, one of the world-class sporting facilities which was upgraded in 2014 to host the 2015 Pacific Games. And yesterday's heavy downpour caused sections of the ceiling to collapse, exposing more than just the need for maintenance.
The office, furnitures, tables, important government documents, including the floor and all the other resources in the office. The rain also destroyed the other offices as well. Most of our computers machines are no longer working, and I guess the reason behind the destruction is due to the heavy rain, but more importantly, the cause of this is due to the defects during the 2015 Pacific Games.
Since the upgrade in 2014, to date, no maintenance or refurbishment has been carried out to the major sporting venues. Mr. James has stressed the importance of maintenance of these facilities as they not only serve the purpose of sports but also serve the tenacities of COVID-19, the global pandemic that is rife in the country at the moment. While the foundation is in full support of the COVID-19 operations, the acting CEO points out that the venue management, who are responsible for management of these world-class sporting venues, need the financial backing to continue carriage of the facilities at the same time carrying out maintenance works.
We have also suffered big losses to our operations, and we are unable to look after the welfare of our officers. We have actually laid off many of our officers, and we are also facing a big challenge in running the administration.
Since April of 2020, when the sporting venues in the nation's capital and other centers declared as operational centers for COVID-19, no payment has been made to PNG Sports Foundation as venue managers for operational costs.
So far, our bill stands to about 5.7 million as of April 2020 to March 2021.
This non-payment of bills directly and negatively impacts the running of the facilities and staff welfare, as the Division of Venue Management operates solely on fees collected from the usage of facilities.
One of the important things that the public and the government agency needs to know is that the venue management do not get direct funding from the national government. The little revenue that we collect for the use of the facility, venue hire, and other activities that we carry out for our customers are used to support and pay for our overheads.
Kilawani, Trukai Sports.
And that ends Trukai Sports. The weather details after the break.
Trukai Sports. Trukai Sports.
This weather update is proudly brought to you by MoniPlus, with you always.
A look at the weather forecast for this afternoon and tonight in the southern region. A few rain showers and thunderstorms tonight, then a fine partly cloudy morning in Port Moresby. A few showers and drizzles in Daru, Kerma and Popondesa, and partly cloudy with a few showers in Alotau. In the Mamasa region, occasional rain showers and possible thunderstorms tonight, then cloudy morning in Ley. Partly cloudy tonight with morning drizzles in Medang, Wewak and Vanimo. In the New Guinea Islands region, a few rain showers and drizzles tonight, then a cloudy morning in Lorengau. Partly cloudy with brief showers in Kavieng. Few thundery showers tonight, then a cloudy morning in Kokopo, Rabaul and Buka, and rain showers and thunderstorms tonight, and a cloudy morning in Kimbe. In the Highlands region, rain showers and drizzles tonight in Mount Hagen, rain drizzles tonight, then morning fog in Goroka and Kondiawa, and rain showers tonight, then morning fog in Mendi and Wabeg.
The weather update was proudly brought to you by MoniPlus, with you always.
And that's been the news, sport and weather for today, Wednesday, the 24th of March, 2021. From all of us here at EMTV, thank you for your company. Pleasant viewing. Good night.